Welcome everyone once again. Good evening. And today is our 288th Zoom session. For last 287 days, continuously we are conducting this Zoom session without any break. And the International Forum for Promoting Homeopathy is formed with the intention of promoting homeopathy all over the world, and our purpose is to spread the knowledge of homeopathy all over the world and unite the homeopathic doctors together in one platform. So many doctors are participating our program and they are sharing their knowledge. That's a great wisdom for all homeopaths all over the world. Actually, this is the globalization of homeopathy, and many guests shared their knowledge. So we are continuing our journey. Today's our guest is our host because Dr. Esmail Sait is today's guest. So there is no need of any introduction for him. Even though I am introducing him, he is the president of IFPH, and he has completed his 15 years of service in homeopathy. And many associations, many are celebrating that event for this Golden Jubilee celebration. And we are, the IFPH is proud for that because Esmail Sait, Dr. Esmail Sait is our president and our asset. And he was a retired principal of Government of Homeopathic Medical College, Calicut, and he is
retired.
Yeah, retired. I said that.
Retired means retired, no? There is no use of retired person.
He is one of the senior homeopathic, experienced senior homeopathic doctor with 15 years of experience in India. So, welcome, sir. Thank you.
Thank you very much. And very much thank you for inviting me in my group as a guest with the host. See, today I'm very much happy because now it is 288 days which over. And before, after 100, I thought to make some comments for platform, but due to some other reasons, you know. Today also, actually, somebody has asked me, due to their sickness, we will postpone the program. I told no, let it be like 3 days I accepted, Tuesday, Wednesday, and Thursday. I can conduct them even any difficult. Yesterday I took my scan. But I have 32 vertebrae now. Out of 32, only 4 were damaged. And in the upper portion, 3 compressed. That's all. And the remaining 20 is intact. So this lumbar vertebra, only 2 is escaped. 1, 3, 4, 5 damaged. Because I met 2 accidents. One a car with a big lorry. They came in the wrong side, entered the main road. They hit it on me. That time I got a fracture in the tibia also. So I don't understand the fracture of the lumbar region. I go to my baby memorial and then get operated. The steel was put on this left tibia. After that, gradually the pain is coming in the back. So I thought we will take a MRI. That time I found that the fracture is very large fracture in the vertebra 3. After that, sometimes I fall down in my home. The first vertebra also damaged. What happened to the fourth one? I don't fall down. Maybe due to the compression of the day through the 2 vertebrae I have in this. Due to the heavy weight, not that much of weight, I'm having 100 kilos, 107 kilos. Now it is reduced to 88.6. By the grace of Almighty, I reduced my weight. 1.4 from the Kindle. Normally, I'm telling to my friends, what was, sir, how much weight you are having? Only 7 kilos. 1 kilo is there. Why should I mention 1 kilo? 7 years only. 7 kilograms. Yes. And that is the jokingly I'm telling this one. Now it is, matter is came to my picture as the lumbar pain. I lost my sensation, the 10 leg fingers, feet fingers. It's a number is there. I can move it, no problem. But it's a number is there. That's why I put my stand in my group. One of my friends was suffering from this one, and so that we can help them. I put the 75 years. 73, I put it into 2 years more, 75. So everybody knows that it is a case of mine. And Dr. T.J. Varghese and Kumar and Baburaj are telling, sir, we know that this is your picture. You know that. Somebody has suggested medicine also. Anyway, we will take the conclusion and we will take the medicine. I am sure that with homeopathy, I will get a new courage and a new health. Definitely, because I cured such a cases in other patients, so that me also recovered with our homeopathy medicine. Homeopathy medicines are very miraculous, marvelous medicines we have. Even then, I am astonished in some times because it is how it works wonderfully, how it goes to relief. I am also wonder so many times. But that also happens in my life also. I think so. Anyway, we will. You can start, I think. Yeah?
Sir.
So, any formality there?
Nothing, sir. You can start.
Don't expect me today. I present only 2 cases of cancer. Tomorrow also 2 cases, pair cases, 2 cases, and we have to have discussions and healthy discussions. And why should, sir, you are not giving Arsinkarbam, Bryonia, Podophilum, and Nasisha together? I know I am, sir. So I don't expect such type of comments from anybody. Yeah. When Vidwan is sitting there, he's having a good practice and everything there. Suppose he's making the Almani method of treatment. But Almani method is not useful for in our cases. Because nowadays we are having the combined and compound diseases. So renal failure. The renal failure comes with the diabetic, hypertension, some other things. The stomach cancer cases, they come in the combination of the liver, brain, male in prostate, female in uterus. Coming. So combined disease they come. So the single medicine method is not possible most of the cases. Very frankly, I'm telling, and not hardly giving the single medicines. Hardly. Because any classical case comes, like asthma, like appendicitis, like any other migraine. Of course, we can make a single prescription without any adding of any other medicines. But in the case of this renal failure, cardiac cases, tumor, and thyroid complaints, uterine cancer cases, anything, we should, at least you should 2-3 medicines because the one is drainage medicine, one is the palliative medicine, one is the curative medicine. That's it. But don't combine in one glass of water, put this all the potions, then shake it and give it. No, that's not a method. Give it sufficient time to act on the body. That's my advice. I'm saying very sincerely telling to my patient, you have to give 1 hour interval, either half an hour interval, some cases, between the medicines. But allopathy medicine, they are having 17 numbers or 18 numbers. You put it into the left palm, then put it into the mouth, say, good. That all the medicine they can take one time. But homeopathy is not like that. We are giving the difference. Even the 3 times come, when 1 time come, 2 times come, and even that I am not giving the medicine, proper medicine, I am giving the exercise for 3 times. For what? For getting George duty. Without George duty, we can't really, you know. Who is George duty? Son of Johnson. You know who is? George duty, yeah. Anyway, could you share my screen?
Please help someone to share the screen. Actually, I don't know.
Already the permissions are given.
Okay, okay. Sir, you can share now.
Yes. The CEO vocal cord. Very common complaint nowadays. Because due to the irregular food, the pan chewing, cigarette smoking, and other fabulous food they are taking.
So the 2 things, your voice is not clear, number 1. Number 2, you can put it in a full screen. You can put it in a full screen. You can do it.
Okay.
Yeah.
Okay. So that
Downstairs, no? Down. Yes.
is it there?
No, the other one. No. No, the 4th one, the 4th one.
1 minute. Hang on. Para?
സാറിന്റെ അതിനടുത്തുള്ളതാണ്, കാണുന്നുണ്ടോ? ആ ഒരു കപ്പ് പോലൊരു സാധനം കാണുന്നുണ്ടോ?
വേണ്ടതായോ?
ഞാൻ സാറിന്റെ മൗസിന്റെ കഴ്സർ കാണുന്നില്ല.
My granddaughter is knows everything.
Okay. Then who is it? Then it's okay. You can start.
Sir, it's okay. You
no,
can.
It is one.
Can you please some headphone or something?
No.
Okay. Then start.
No phone.
Then you can start.
One minute.
Yes, doctor. You can continue. Yes, citizen.
Yeah.
Yeah. Now you go on.
No,
You can start.
Yeah. So vocal cord cancer is a very common one nowadays because nobody have the use of the voice and taking of pan parak and tobacco, chewing, other causes. So it is a usually the vocal cord cancer begins as a node on the abnormal cells, a small node with different growths and within the vocal section. So for which they are having the hoarseness and pain, dysphagia, everything comes. So it is, what is the cancer? Cancer is multiplication of the normal cells due to stick. Any complaint comes in the cells to multiply and the proliferate. That's why the cancer comes. So symptoms of the vocal cancer, voice change is there always because they are having the humming sound. Sometimes they have the loud sound. Sometimes they have the pervert sound like that. So they are not using similarity of the sound. Different sounds they are producing because of the thickness of the vocal cord. The chronic sore throat, that also causes the change of voice. Then dysphagia and loss of weight. Due to the dysphagia, they are not taking the proper food. That's why they are losing their weight. So difficulty of breathing. Due to the congestion of the throat, vocal cord, they are having a difficulty of the breathing. Sensation of the something is lodged in the throat. It's just natural because the growth is there. So the lodging for sensation also is there. They want to split it out. They want to remove it. They want to make it hawking and some noises to escape from the lodged sensation. One or more palpable lumps in the neck. The cervical lymph node is there sometimes. So maybe it is painful or not painful. Cough and bleeding expectation. Due to the soreness and the lodging sensation or the growth, they are having the irritating cough. And due to the irritating cough, the sore will become tear off, then blood will come up. This blood not coming from the lungs. Lungs bleeding means this one cancer lung or tuberculosis like that. This is not like that. This is from the vocal area coming up. Due to the very labored cough. This is the name of the Bashir KV. It's a diagnosed case of CLRE, vocal cord. He came to my hospital after completing the chemotherapy and medicine. That's the cuts for us. All homeopaths getting the later stage of the disease. They are coming with all anomalies they are doing it. And they are coming with the palliative side also. We getting the medicines in the very later stage. So we can't do anything properly. Even then, we can do something. Suppose they are coming earlier, we can cure it. More patients. But this is, they are having the chemotherapy, the radiation, everything is one. I was published in my Sugino Bhavandu, the old man. Still he is there. But he is told that due to the radiation, my throat was wrinkled. So one of the doctors, Nasser from the American, Indo-American hospital, they told, we leave that one. Sound we don't get it. But now it's okay. Maybe it's due to the homeopathic medicines. You don't stop the medicine. He continued it. So he continued for 3 years and he got to now he stopped the medicine. Sometimes he calling me. That's a 6 months also he called me. Now he's 93 or something age. Very healthy. So the Bashir is there is required. He came to my hospital on completing the chemotherapy and the result. He was under my treatment from 4/5/2015 and stopped the treatment maybe May 2017. He presented with the difficulty of breathing and pain submandibular region, the comment of the vocal cord cancer. After going through the case of history, I started my prescription with the lycopodium 30, 2 doses. Because the other symptoms are very common to the vocal cord CA. But I prescribed lycopodium because he can't tolerate any kind of coldness, cold drinks, even common water causes pain. See, this lycopene I'm giving 10 potency, those are having the tonsillitis with the aggravation of the drinking of ice cream or cold drinks. After one dose, after 1 month, they recover the pain. Then I ask them to take 6 months medicine, so that we will be all right. Some adenoid comes with these sort of symptoms. Suppose they prescribe me lycopene or some other medicine. I ask them to take this for 18 months, so that we will completely cure. These are things I'm understanding within my experience of life. So he was given lycopene 30 due to the intolerance to the cold by taking or from the outside. I considering his acute discomforts, medicine was given only for 15 days. 15 days means 2 doses were given and asked them to come back after 15 days. On his next visit, he was better. So SL2 doses was given. But you don't forget to give the SL and PT, get the money, okay? After 3 months of treatment, I increased the potency of lycopene 200. Because after 30 potency, last time he got having something puzzling of the symptoms, not improving much. Sometimes he got some pain in the throat, and after taking this water, so I returned to 200 potency. He was showing tremendous improvement. So I did not change the medicine. Repeated 200 potency once in 2 months. Once in 2 months only, 2 doses I'm giving. And this one, the actual single medicine treatment, no? Animani method, purely animani method. But some other case, complicated case, suppose we have to give. See, later he had occasional cough with the tickling in the lab. Due to this one, maybe some softness on there, tickling is there, larynx is there, vocal body is there. So naturally he got some irritating cough. So irritating cough, I prescribed Drosera therapy. Why? Because of Drosera having the tickling on the throat while going to thinking about the bed. After touching the pillow, you think about the Sahavatema. After comfort of the bed, you think about the phobia. So this is Drosera given 30 potency, few doses, and that was relieved better. Later, he had very few occasional associated symptoms. So I want to stop the treatment. Casualty 1 was given between as an intercurrent. Later, he took PT scan, PET scan, 2016, which showed no evidence of any residual recurrence of the metastatic lesions in his body. This is the before treatment they have given. And during the treatment, after 3 to 4 months, this much recovered. And during the treatment, the report was this one. When the printout is not limited, you can read it. Okay, we can read the known case of CA larynx, post radiation, and chemo. Calcific nodules in the right vocal cord. This is the impression of the first stage. This is the after treatment. After treatment, the comments was there, PET scan report was there, and sorry, this is the final report. You can read it here. In the known case of CA larynx, post chemo radiations, the whole body PET scan findings are suggestive of no evidence, no definite scan evidence of the metabolically active residual recurrent lesions in the vocal cord. Post-radiation therapy, when the changes were there. So everything is totally gone and he recovered. So that case, we can discuss later, both cases. Or you want to discuss the first case? Any comment there? Hello?
Sir, I think it is better to continue 2 cases and then we'll discuss.
Yeah, fine. Thank you. And then this the second case was pituitary adenoma. Pituitary adenoma, not even common, but I got a lot of cases. But the thing is, I don't think that they completely to reduce the adenoma. After 25%, patient feels better. After 50% reduction of growth, patient is very well and doing the natural and the normal speed. Such a case will be here. Mr. Ghaffur B was a diagnosed case of pituitary adenoma and was under my treatment from 14/9/2010. He presented with a blurring of vision and recurrent attack of headache. We started the Sait 0/3 twice daily because it is why you prescribe Sait. I am using that one because of the brain complaints where the proteins are very rich. Wherever some complaint comes, I am thinking about the tuberculum as well as the Sait and calcareca. These are my 3 favorite private medicines. Those who are having the complaints of the brain-related diseases. So Sait 0/3 was given. I'm giving the different potencies, 30 potency, 200 potency. Sometimes straight away I'm giving the 10 potency. Here 0/3 because I need a gradual improvement so that the patient will be recovered. So I started the Sait 0/3 daily. This was continued for 3 months, followed by a single dose of carcinosin 1 because the background is the carcinoma. So I prescribed carcinosin 1. His headache reduced in the first month itself. Later, he did not complain about the headache from 3rd month onwards. The blurring of the vision also gradually reduced. In order to enhance the vision, we gave him arnica, 1 And I was given 10 also, but was not mentioned here. 10 also after the 1 potency, which is along with the Sait 0/3. That I have not stopped the Sait 0/3. Only 0/3 was given till the end. Till then, I have not changed the potency. Only 0/3 was given because I got the continuous and very favorable improvement. That's why I not want higher potencies. When we think about the high potency, naturally, when the given potency is stopping acting, not proceeding properly, there you can think about the high potency. That's the advice of Dr. Hahnemann. The melandrinum 1, 2 doses, night and morning was given once in 6 months. A single dose of calcium 10 again after 1 year. Now this case was almost recovered. No other complaint that blurring is stopped, headache is stopped. So I got a lot of cases of adenoma. Because some tumor comes in the base of the brain. Suppose they are doing the surgery, they will lose the eyesight, they lose the movement of the body. I think they will lose the sight. So there I am advocating. Suppose we are going to treat the surgical procedure for this much action. But so we're going the homeopathy action, we can survive for a long time and doing the favorable and modified life. That much I can assure. That much assurance I'm giving normally. So melandrin 1 2 doses night and morning was also given the 6 months thing. Once in 6 months. And the same time the Sait 0/3 is continuing, Don't forget that. That was continuing with all the medicine. And so once in 6 months, and I think also calcium 10 was given in a year. Now the patient was perfectly healthy without any visual problems or headache. His MRI results are also showed reduction in the size of the pituitary adenoma. I told you earlier. We don't expect the entire pituitary adenoma will reduce for a time being. Of course, After 2-3 years treatment, it will reduce, it will vanish adenoma. But patient feels better after the 25% reduction onwards. So that patient maybe they will stop the medicines. But now I am all right. Not taking the no medicine. And after 6 months, 1 year, they came again back to my hospital. Sir, this is appear again. I don't ask him whether I ask you to stop the medicine. You are given 1 year treatment. No. 1 year treatment is not possible to cure all the cases. Relief only. So reduction the size of the adenoma. See, this is the first report. See the size. 2 into 2 into 3.7 centimeter. AP transverse and process. Is the size of the adenoma. Okay. Now, MRI brain contrast with the special recurrence of the pituitary glands follows up ready. This 1.35, 1.3, 1.48. That's much reduction. Meantime, he got tremendous relief. He not having any headache. The blurry vision is there, no sight fog. Everything is okay. But how much is reduced? Only 40%. Am I right? 40% reduced. So meantime, he got a relief. His final report for you. Ajay's report. The impression. Images is a known case of pituitary adenoma. On follow-up study. Enlargement pituitary gland showing the peripheral enhancement with the contrast. Comparing with the images taken 14/6/2011, the presented study shows the reduction in the size of the lesion, change in the spinal density, and peripheral enhancement with the contrast. Above findings are suggestive of the tumor necrosis. So that stage was it. When the necrosis stage comes, it will go very, very, very easily. Because the inactive form. Any tumor becomes a necrosis form, that's inactive form. There's no healthy tissues are there. So it will go, definitely. The final report, they have gone for the second opinion from Mother, I don't know. There is 13 mm into 10 mm into 11 mm. Again, they reduce. After 6 months, they go on to the Amartha and taken this one. Then they stopped the medicine. They came after 2 years back with a little headache. So I have given the tuberculinum and Syretia. And after 3-4 months, again they stopped the medicine. So these are 2 cases I am presenting for your favor, discussion. So, again, jump in. Nobody is in the forum?
Yes, sir. Yes, sir.
Where it's without mic, with mic.
No, we are listening. Actually,
How you feel? First of all, tell me that one. How you feel? Well,
so Dr. Manoj will tell.
Manoj, every day he's telling for all comments coming from the Manoj and as well as the RFP man.
No, sir.
Yeah.
Okay.
So any discussion you need, we can.
Yeah, that will be better, doctor. Because rather than going for a PowerPoint presentation, the discussion will be better. So can I invite Dr. Ajni?
Yes, sure.
Yeah, I'm just inviting Dr. CJ Varghese. Dr. CJ? CJ Varghese sir. Can you please?
Hammer theory.
Mr. Feroz, already Dr.
Yeah.
Hubert De Silva and TN.
Yeah.
So,
You can call. You can call them.
Then when Dr. CJ Varghese comes.
Yeah. See, I'm not.
CJ there?
I don't know. Let me check, sir.
Yeah, Dr. CJ Varghese.
Sir?
Dr. CJ Varghese.
Thank you.
Doctor.
Yes, sir. Yes, sir.
Our beloved President, Dr. Sait, and all the participants of this evening's wonderful session. I really appreciate the two cases that Dr. Sait has brought out for presentation. These are simple, what we call samples. He has got a large collection of similar cases that he will be presenting. What I felt is that when somebody celebrates feasts, that means golden jubilee memorials like this, we have to give him feast. But instead of that, Dr. Sait is giving us wonderful feast, intellectual feast. So these two cases should surely encourage us to go to his deeper line of thoughts for selection of these remedies and how he has given relief for these patients. See, regarding cancer, there is a saying that cancer means cancel. That means incurable. But when I understood, as many of you know, that I am following also a new line of thought. Dr. Hammer has said that with cancer, nobody dies. So that was a wonderful idea and a new idea, a novel idea for me. Then thereafter, I also got courage to handle cancer cases. So when I attended all the homeopathic discussions on cancers, the way how we have understood is not enough. We have to have a different approach to cancer. That is what I mean, or I understood nowadays. The scare of cancer or scare around the nomenclature of the disease, an adenoma or multiple myeloma or leukemia or breast cancer or whatever. There are so many things that we do not know. Why this particular incident happened in this particular tissue? What is the importance of this particular tissue to be affected with this malignancy? No science so far, and never in this modern, so-called modern medicine, not even homeopaths are given that idea. So this is a wonderful idea or understanding I got from the German new medicine, which I am referring to. So I appreciate the way how intellectually or intelligently our beloved Saits are selected these remedies. That is the most important thing. So this remedy selection is not always explainable, because the logic behind the selection of these remedies will be really helping us to give the relief. But before that, there should be, that is why requesting this evening to all my colleagues, there should be a reason, and that reason is in the dynamic plane. And that dynamic plane is the mental plane. And that mental plane gives us explanation for the development of cancer. Why a particular person develops a cancer on a particular day or within a few days' time. And that becomes important. Why a person gets breast cancer, why a person gets leukemia, why a person gets this pituitary adenoma. So there are explanations for that. So now is not the time for explaining all these things. But if that we homeopaths learn that also, it should be a wonderful revolutionary knowledge that we will be acquiring. Therefore, I invite all of you.
Dr. CJ,
yes, sir.
Dr. CJ Varghese, sir, I wish to share a small, a particular case. That case is forwarded by Dr. Esmail Sait for the last week. So I wish to know.
But it might not belong to me.
Yeah. So, sir, can you please explain, Dr. Esmail Sait? Can you please explain what is it?
No, he has already explained it already. No, in the group it is already explained. And therefore, from that point, I will try to explain that.
I want to see it, CJ, in the next few days.
Yeah.
By either telephone or by visual.
Yeah. So he has promised that the patient will be coming to my clinic, or as he said, we will be having a discussion.
So can you please explain right now what's happening for that patient?
Yes, I will try to. I don't know how many or how far everybody will appreciate that thing, because the tissue is important. Which tissue? Because it is the bony tissue or the skeleton. Which part of the skeleton? It is the spine. What is the role of spine? Spine is the most important skeleton, a part of the skeleton that gives support, stability, and integrity, or the grit, as we say. In a common man's language, if somebody failed to behave in a very bold manner, we will usually ask in any language, where has been your spine? Did you not have your spine at that time? That means when somebody was not bold enough, we will ask like that. Therefore, the spine indicates the strength, the support, like that, so many things. So from neck down to the coccyx, all these areas are important. So here in this particular area, the number of vertebrae that are decayed or undergone osteoporosis surely shows the conflict, the most important conflict, that is self-devaluation conflict. The person or the patient is having a self-devaluation conflict. So which part is affected? That's the most important thing. So when the cervical part is affected, we will say intellectual self-devaluation conflict. If the dorsal area is affected, we will say the core of the individual is affected with the self-devaluation conflict. If still lower lumbar region is affected, we will say, it is not, we will say, after 30 years of research, Dr. Hammer found that it is the lack of support is the problem. The person is suffering very seriously about the support. He is not getting support from his community, from his colleagues, from his profession, from his family, community, etc. So that when it becomes very serious, then the person is affected with that thing and that particular. And Hammer says, and down to the present case, where I understand the sacral area or the sacral area, lumbosacral area are affected. So what is the function of an individual with that area? So the support, as I understand from this case, the person under reference has lost support from wherever, I don't know, because I have not taken the case in detail. So maybe from the community, maybe from the profession, as he or she never expected. So she expected a support. She didn't get it. Now, some lower or the sacral bones are also affected, lower. So that area is for so many. What is the function with that part of the body? That is the important thing. So the function is where we sit with, or the support, still down support. And as all of the listeners are adults, I can say that that area is mainly required for the sexual act or sex act. So during the sex act, from the part of the male or female, that area is important for the copulation act. So a person who is having a desire for sex, but I'm not able to perform that act. I have desire and I am not able to perform that activity, then this part will be affected. So it is a meaningless thing for labeling a particular disease as malignant or cancer. That is according to the German new medicine, because a particular growth, when it has grown beyond a particular range, which is fixed by the allopaths, then they've called simply as malignant. So it is just like any other growth or any other destruction. So which tissue will be affected by a growth, which tissue will be affected by a destruction or ulceration. These are all designed by the embryological understanding of a human being. So which tissue? Yes,
Sir,
I will
as far as
go
this
on like
case,
that.
as far as
Unless
yeah,
you
as far
stop
as
me,
this
I will
case,
continue.
yeah, sir. As far as this case, for which medicine you will prefer, and which homeopathic medicine you will prefer?
Very sorry, Farouz. All the homeopathy doctors will support me, because by seeing this case, we cannot prescribe a homeopathic remedy by a homeopath. If the person is a genuine homeopath, I am not, at least, a person who will prescribe right hand, because I do not know the inner reasons for the development of these things. I have to verify it with the patient. Then only I will come to the thinking process. The dynamics of this individual, I do not know. We are seeing the third component of an individual, that is the body, because the primary component is the mind. When we say mind, it is not the conscious mind or logical mind, it is the subconscious mind. So subconscious mind is the place, we cannot say place because it is not at all a materialistic understanding, it's a dynamic understanding. Dr. Shaji Kudiat will explain that dynamic.
So I can understand, sir. I can understand. So, Sait,
Yes.
sir, what's your opinion for the last 50-year experience? What is your experience for the CJ Varghese comment? What is your feeling about your CJ Varghese comment? Sait, sir. Sait, sir.
Is it question to me?
Yeah. So, what is your feeling about CJ Varghese comment? Yeah.
Suppose CJ telling this much of a story and in the truth, maybe I have no agitation from my family members only because of my profession. What I am thinking about my profession, I'm not enjoying that one. I'm not satisfied with that, because I have tried so many times for making combination, making single unit in homeopathy section because the betterment of the homeopathy. That's the lacking of that one. Since several years I'm forcing and trying this one, but I not succeed. Maybe hammer telling that one may be the cause. I'm agree with that one.
Okay, great. Dr. Shaji, yeah,
understand. Supporting with the friends, supporting with the community, supporting with our system, everything is related, no?
Understand, Doctor.
Of course.
Understand, Doctor.
There is selling that the law is supporting one. Of course, it is supporting one.
Yeah, Doctor.
Now I am walking. Sometimes I am slipping my legs. Yeah, I am walking with my walking stick. Sometimes slipping it. Suppose I am forgetting to take a walking stick. Now I learned 2-3 days before. Because the acute complaint was there.
Great.
So suppose CJ is telling that one is truth. Because I am disappointed with our system, our community, homeopathy community. Totally.
So
very much worried about
no. I just want to know. I just want to hear from Dr. Shaji. Dr. Shaji's approaching is also entirely different. Dr. Shaji, what about your opinion, Dr. Shaji Kudiat? For a particular case, for this particular case.
For Sait sir's case?
No, for this particular case, no? Yeah, this Sait sir case, right?
The vertebral column case, that is not a cancer. That is, I think it is an injury happened. And that is...
Not cancer, that I'm sure.
Yeah, that is a byproduct of an injury and also muscle spasm, because you can see the loss of lordosis, the structure of the vertebral column because of the muscle spasm. And it is not a cancer diagnosed case. Of course, the mind is very important and influential.
Nobody told this is cancer. Nobody's mentioned about cancer.
Yeah. So it is not, a very...
CJ was given the hammer theory that is my lower portion, the lumbar to sacrum, is supporting differently. The body supporting is happening to the lower part. The supporting part is weak from my side. But my side means my family side is okay, perfectly okay. My children, my wife, and I married and one my wife earlier. She no more now. She's also supported me. The present wife also supported. And my father was a great supporter. My teachers also supported. Even then I am making some one calamity with them. Finally they're telling that you are the one of the our favorite children, lovely children. One thing that happened in my life also. Still I'm respecting my K. Joseph sir. Now he is in the Pala. Because I can't tolerate anything to my teachers. They are there because my engaged factors. In the homeopathy field, I expected something more and more. Not getting it. Because of the ununity of the below. Suppose they are making any unity, suppose they are standing in a single way, you can do someone else. What else? Some of the homeopathy doctors agitating and making seminars, homeopathy is wrong. Then why should you make it? Leave them. Go to the market and fish market. Get the business with them. They will get much money than the homeopathy. Then why they are coming to the agitated homeopathy? Suppose they feel the homeopathy is wrong, leave them. Leave it. Go to hell. I'm telling that that sentence. I'm not mentioning the name of the fellows. Maybe they are agents of our enemy. They're getting sufficient money from the agents. Otherwise, then they are giving the Bellona, Breonia, rest of the taken. What foolishness?
I think one thing, one thing happening with this case is there is some loss of calcium or demineralization, mainly because of that depressive state of mind that Sait sir is explaining. Because of his frustration in the homeopathy community, we are all trying to do great things and great enhancement of homeopathy. And certain people who are in the leadership in the organizational level are different motive of occupying the position. That is frustrating, sir. And that frustrating nature can produce demineralization of the bones because it is a depressive state and that produces hypothyroidism. I don't know whether Sait sir has checked the thyroid.
It is normal.
No.
Calcium level is normal. Serum calcium is normal. Thyroid function is normal.
Okay.
Yeah.
Okay, that I am telling different.
My BP 110/70 always.
Okay.
Till that as of my first wife. After this one is made something. Okay. My sugar level is very normal. But sometimes I am having the hypoglycemia because of heavy work or something like that. That's why I am taking some time. I'm not taking any medicine for those. Medicine also taking little. Not taking the medicine properly. So my family, my children are quarterly. We're not taking the proper medicine. That's see, very costly medicine. Suppose I give it to the others, I'll get money. Why should I waste myself?
I think in every chronic disease, there is a connectivity of the mental emotional state in fixing the location.
Suppose CJ explaining that one hammer theory. I think that firmly I think that it may be the cause of that one. Because I'm much worried about it. My community is not taking the respect. And then, of course, they're treating and liking me so much than any other their teachers, they're liking me, loving me. But they're not disciplinary. They're not they are not applying their truth. Suppose I'm taking phone, after coming from the classroom, I called all the members. Everything agreed. Yes, sir. Yes, sir. Yes, sir. After 5 days, no response. After 5 days, I called them. Sir, the members are not agree with it. See, they are leaders. They're telling the members are not agree with it. The thing is going on like that. That is our curse. Homeopathy is not developing properly. It's due to the curse of the person.
No, sir. The most positive thing about this thing is that body never does anything harmful for us. There is a positivity in all these actions. The positivity is that the body is trying to strengthen that particular part of the body, which is decayed. So why it is decayed, I already explained. And this is to improve your strength. So how it is to be done? By overcoming your conflict. So the way how you expressed gives out some very beautiful indications about your remedy, your constitutional remedy. Once it is given in proper potencies and repetitions, this and along with that, what we call or what I call is GNM therapy, German New Medicine therapy. So only by making you understand that there is no meaning in finding fault with the profession or the associations who are not associating with the SETSA. So we are all human beings. We will end up in some part of time. And that is not the end of homeopathy. Homeopathy will live longer and will remain in this world forever. And therefore, we are we are facing this sort of situations to help us to improve. And that will surely improve provided we change the mode of thinking process or the mode of activity of our mind. So this is a syphilitic stage, destruction. And we will find out what are the characteristic syphilitic symptoms in this particular patient. And while taking into consideration those syphilitic aspects and the remedies, we will select a remedy that will surely improve. Just as the bone cells got decayed, it is possibility is there always to replace this part with the proper cells, bone cells, and that will surely give strength for these things. And you see, we have been hearing for him for the last 5 minutes. So there is no meaning in finding fault with the associations of the leaders of these things. So there will be always forget and forgive, because the resolution
is not disappointing. I am not disappointing, man.
No.
That the moment I will get my courage.
We will be taking a number one.
I came with a word, homeopathy word, with 1 rupee and 1 damaged scooter. Damaged scooter is borrowed by my brother. And ask him to give me 1 rupee every day. I will give you the money back after 3 months. I will participate to my share with your family. See, by the grace of God, I given the money on 7th day. 7th day. After 3 months, I taken the all responsibility myself, and I relieve my brother. You enjoy it. That is the expense I am getting. So suppose I am losing something, a lot of rupees I am losing. No. The moment I disappointed, the moment I agitated, immediately I think that what I gained, what I got it from my family, nothing. This much I gathered, this much I earned. Sure, that's good. That's what comes into my mind. Positiveness, positive mind. I think that was the positive mind may be getting me like this. Otherwise, I will fall down.
Doctor, can I call one by one?
Yeah.
Yes, of course. Don't hesitate.
Yeah. Dr. Sridhar Kuru. Dr. Sridhar Kuru.
Yes, sir.
Yes, sir.
Thank you very much for the opportunity given for me. What Dr. Esmail said was telling, it is completely true, that I appreciate his efforts for that. First, I appreciate that his 2 cases that he is cured. That is wonderful. That even I tried some of the cases with that, along with the Dr. R.P. Patel, that the government of India told me that once that you go for one survey where the Dr. R.P. Patel was treated for the cancer, that I went several person to person, that I took that from his hand that the addresses, and I went personally to home. Then I saw the people that whether some people are alive or not, but about 20 to 25% of people are alive, and the rest of them were not alive. But I realized one thing. Then I asked, why you went to Dr. R.P. Patel and you took to the treatment for cancer? They told that we got relief. But when the patient was dying, that they were happily dying. There was no pain. There was not that much symptoms. The life was extended and sufferings were able to reduce. This was definitely, it can be possible. Even I tried myself. Example, some of the areas of the cancer, example that the thyroid, that the breast cancer, and even to the prostate cancer and etc. Some cancers, if we may be removed, that mastectomy may be done, and after that we may give continuously homeopathic medicine. Definitely we can extend the life and the sufferance can be reduced. And I treated so many cases, even 10, 15, 20 years after the cancer, they were alive and they were not having any problem. It is possible with homeopathic medicine. That is the part number one. So I appreciate Dr. Esmail Sait to show the this profession, it is possible to cure. The second part that I like to tell, of course, in homeopathy also, we are taking the first mental symptom. The mind is having a very big role in prescribing to the homeopathic medicine. We are also seeing that is why we are able to cure so many depressive cases. Even we can prevent the suicidal tendency. Even the problem is there, still how there, even the homeopathic medicine can change to the mind, even the emotions, even the physical also. It may take a little time, even pathology, it can be changed. That is why all this is happening.
Yes, sir. Yes.
Whether I must have to stop?
Yes, sir. Yes, sir. Because of the time limit, I'm just concluding that. Yeah.
Thank you very much.
Thank you, sir.
Wish you all.
Thank you, sir. Yeah. So, Sait, sir, I have a question about that. So, since how many years you are treating cancer? Since how many years you are treating cancer?
I think it is my beginning of my case, beginning my practice. I was my practice at Mananjiri.
Sir, how many homeopathic doctors in Kerala treating cancers?
Most of them are treating nowadays they know the homeopathy medicine is good for the cancer. So I think
my question to Dr.
CJ is not having the supporting measures. They are thinking about something. They are giving
yes, sir. I can understand, sir. So then my question to Dr. CJ is, before, as far as your speech, you told me that, you told us that before GNM theory, you after you came to know the GNM theory, only you are treating the cancer. Why you are not treating the cancer before that?
No. It's a misunderstanding, Mr. Feroz. What Dr. Sait said is the right thing. Every homeopath is treating cancer. That all depends upon the number of cases who rely on the practitioner. So there was a time when I remember that day when Dr. AKB, Ajay Kumar Babu, was presenting some cases of cured cancers in one auditorium. I remember it was in Kottayam. I was just wondering whether I also will be able to cure so many number of cases and keep the patients alive before such an audience. That was my ambition at that time. But now I can very confidently say that what is cancer? It is so simple. That means there is no meaning in saying that all the people we treated homeopathically are alive. If they are not alive, that is the wonderful thing. Because Dr. Hammer, when he was persecuted, I would say, or executed, or the legal authorities made for an investigation and found that out of 6,500 cases he treated, cancer cases, out of 6,500 cases, 6,000 persons were alive without homeopathy treatment or any other add-on treatment from any therapeutic or anything like that. So when we say with the therapy, that just to make the patient understand that this is because of this, from since what time you develop, in what particular instance, we can predict the type of conflict in that particular case. For example, I am not going to explain because of the scarcity constraints of time.
Understand, sir. Sir, understand. So my question to Dr. Shaji is that, sir, is in our Kerala, the homeopathy doctors are still confident to treat cancer patients? To Dr. Shaji.
It depends upon doctor to doctor, because some are confident with medicine. Medicine alone will give a great relief. I also used to treat cancer in the beginning of my career as a homeopathy doctor with the medicines alone. Only on the process of treating cancer, trying to identify from where cancer come from, and the path towards development of the problem, I identified the relationship between the mind, vital force, and the DNA, because there are abnormal mutations and epigenetic changes happening in the DNA that leads to the cancer development. So my curiosity and investigation to look for the causes that produce the cancer lead me to the identification of this relationship between the mind, vital force, and the DNA, and to give an explanation of cancer development and DNA regulation and all these things. But before developing all these ideas, I used to treat cancer, and there are patients who survived even now after 17, 20 years. They are still alive. They are supposed to live only 6 months in Philippines. They are still alive. I have many patients of that nature. And so many doctors in Kerala are treating with the medicine, and the majority of them, some of them are not so confident because they believe cancer is a very difficult disease, because conventional medicine all over the world treat cancer without understanding from where it comes from. And their treatment is only targeted in the destruction of the tumor or the removal of the tumor surgically. Whatever way we destroy it or remove it, the tumor still come back. So the cure never happens, and the patient is in panic, the doctors are panicking. But in homeopathy, we are able to go beyond the physical plane to influence the dynamic components, especially the vital force, through our medicine, and that create a little more deeper cure. So, but those who practice with the medicine also is creating lot of results, but they also fail to identify how cancer develops, and that many of them lack confidence in confidently treating cancer.
Sir, I have a question to Dr. Sait sir once again. Sir, our education system in homeopathic education system is given the complete 100% confidence to the students. They can cure cancer and the something like a big diseases.
Malaga should come from the heaven. That's my answer.
Pardon, sir?
Because nowadays our colleges are not committed to this one assurance.
Dr. CJ,
some of the
can you please?
doctors are giving assurance. Most of them, they are maybe, I don't know, disappointing characters are there.
Dr. Shaji, do you have an answer for that?
Which one?
No, for my question. Say our education system in homeopathic education system, are they giving?
It happens in the future. Most of them.
It's happening now. Is it happening now?
Will come as a volunteers of homeopathy. Then they will protect homeopathy.
I think one problem with our homeopathic education system now is the scientific background of how homeopathic medicine influence, and how the holistic perspective of that basis of scientific basis of the holistic systems of medicines are not well understood. So in the medical world, every scientific perspective is going through in a material perspective, and that is what we study. And that makes a lot of confusion among the doctors, including homeopathy doctors. And that is one of the reasons for the lack of confidence, because homeopathy is far superior than the conventional allopathic system of medicine. It is brought down by the wrong scientific understanding prevailing in the world today. And that produces confusion and lack of confidence among homeopathic doctors. But I think in coming years, the holistic system is going to gain a lot of scientific ground, and that will definitely create confidence among homeopathic doctors. And that will be a boon for homeopaths around the world.
Great, great. I'm moving to Dr. Lokmani Gupta. Sir, you can speak. Yeah. Dr. Lokmani Gupta, yeah.
Hello.
Yes,
welcome
sir.
to all. Welcome to all on this prestigious platform. Very good to listen the healthy discussion. So first of all, I congratulate our president for the golden year of practicing. It is golden jubilee of his practice. He gave 2 golden cassettes to us with the golden rules to select the medicine automatically, nosors and myas. Very good collection of cassettes. And with the reports, with the scientific explanation and the comparison of case and post-case treatment. This is a very much, very essential. It's very essential.
The voice is very low. I know
Sir,
that.
your voice is very low. We can understand.
Can somebody will explain what you're asking?
Sir, I'm not asking, but I am appreciating your approach.
Thank you. Thank you.
I am appreciating your approach.
I thought that you are asking some questions regarding my
Sir,
way of treatment or something
also.
like that.
I'll ask a question also in next time, but I'm appreciating your approach for uplift of homeopathy. The biggest lacuna amongst us, or I can say amongst majority of homeopathic doctors, schools and practitioners, is they talk in air. They never keep their report proper. And that is the only phenomenon why we are lagging behind. The doctors of other pathies knows more than what they do. But we are unable to expose ourselves because of lack of report, lack of scientific study.
I will try my best level.
Yes, sir, I'm doing my practice on the same track.
Thank you, doctor. Thank you, doctor. So,
one question I want to ask. Sir, yesterday only, I got a case of periampullary adenocarcinoma, malignant in nature. So please guide in a nutshell, what should we do for that? Hello? Hello?
Yes, sir.
Hello?
Sir, you can speak. You can speak. We can hear you.
Thank you, sir. Sir, yes, I treated about 5 cases of cancer. I treated the cancer of gallbladder, periampullary, and all in very initials of my study. And my paper was published in a very good journal of that time. Secondly, I also treated case of this vocal cord nodule. Yesterday only, I got a case of periampullary adenocarcinoma, metastatic in nature.
Periampullary carcinoma of the liver.
Yeah, yes.
Yeah. That is very, very difficult to cure it because the growth comes in the periampullary region. It is always breaking. There is no medicine for properly acting. But symptomatic really we can give. Suppose they are giving any chemotherapy or something, it will blunt that to the region. The patient will die very soon. Suppose they are not doing anything chemotherapy, they leave the patient as it is, making some drainage process. Then along with homeopathy medicine, they can live for a long time. That's my experience. I got it.
Sir, what can be prognosis of this case? How long he can survive with the medicine? Because
One patient is still he is living. It's at 12 years. 12 years.
Sir, his total bilirubin is very well in control. And urea and creatine are very well in control. And
you mean renal failure?
Hello?
You mean renal failure cases?
So because of the time limit, I just involve. You can. I will share that Dr. Esmail Sait's number. You can call him directly.
Welcome,
please,
sir.
please.
Welcome, sir.
Yeah, you anytime you can call me.
Thank you.
Hey,
Sir.
your name and you are in the platform, man. We'll discuss.
My pleasure it will be, sir. My pleasure.
I'm going to bed at 12 o'clock. I will wake up by 4 o'clock.
Okay.
At 4 o'clock, when up to 5:30, you don't call me. Because
Please
my
give me
prayer
your
time and
number,
everything.
sir. Please give me your mobile.
Yeah.
After 6, till
Prasad,
10:30, you can call me.
Mr. Prasad, you can unmute and
call
ask.
me, no problem. I will attend the call. Yeah, Mo,
Prasad?
Our Prasad is there. Yeah, he
Yes,
is
sir,
there.
yes.
Some of 3 persons are there. Use
Yeah.
chance to ask.
Yeah, Prasad, you can speak. Yeah.
Thank you. Good evening to everyone. And it is nice discussion, and definitely experience is the best teacher. She gives test first and lesson afterwards. So from Ismail said, the 50 years of experience is coming for a medicine, as act as a medicine. So it is a wonderful thing, and it is a real learning for everyone. And definitely maybe why there may be some discussions it's happening in why there is no discussion of cancer in long back. You are already going to the history is above below 90s. The very few patients of cancer may be noted. There may be after that it is converted as a disease of money, and it is converted as a disease of concern, and how it is grown, it is always all the habits, everything is connected. It's not only from one particular thing, it is definitely somewhere we may be joined with the CJ's philosophy also somewhere. The fear is created tender word. The fear of disease sometimes, or fear of money, it is sometimes, and it is converted and cultivated like that. So there are some combinations of integrated approach. And my question to Ismail said, sir, why, I think some disturbance in between. There may be an integrated approach of going of, we may be seeing with allopathy and homeopathy is combinations. And
combination is good.
Ayurveda,
Integration is good.
Follow-up treatments.
Integration is okay. Because we need the help of allopathy doctor for diagnosing the cases properly. So today also one of my girl admitted in my hospital. He undergone 3 operations. Suddenly he lost his sodium. We started sodium, but he got shivering. So I transferred the patient to the Mitra hospital. They wonderfully managed. They came back. They sent him back to me. And now he's in my hospital. New time they went there. They are given the sodium and the blood transfer done. They came back now to the hospital. So we need the help of them. They also need our help, but they are not care about them. Care of us. We are all supporting them. We are all care about them because we need to help them. But they neglecting sometimes. But nowadays, most of the big doctors, very white doctors, they are respecting. They are respecting. Yeah.
There may be some integration in Ayush system itself. What I mean is communicating to you is maybe an Ayurveda or yoga or other things, other combinations may support it. Even
Mr. Prasad, I proved some of the Ayurveda medicines. Kurandol tea, I proved in homeopathy section. Now it is available in the market.
Right.
And Kiriganelli, I proved. This is also not in the market, but some of the doctors are using it. So, so many medicines we are. because we got good hope with the Ayurveda because their medicines are limited one. They are using the limited cases. But suppose we proved the medicines, we can go with the enormous, very higher level. We can go.
Definitely. Any integrated research in that kind of way, we may be thinking, I think it may be, we must think it Ayush systems, inside the Ayush systems. We have an integration support, maybe thinking it will be a good idea that I thought I should share. And thanks a lot, Dr. Esmail sir, and for a wonderful presentations and maybe continuing tomorrow and day after tomorrow. I really, it is a nice presentation. Thanks a lot. Thank you, Feroz.
Thank you. Thank you, Prasad. Dr. Danesh. Yeah.
Good evening, all. And we are lucky to have one of the living legend, Dr. Esmail Sait, as our president of our association. And not only that, sir has presented 2 cases of incurable cases as far as others are concerned, but he has shown how beautifully homeopathy works for such patients. So this is the time we need to bring all these things to the public notice. But unfortunately, our platform, we are not getting such support from public. So we need to get into touch with those people who are outside the world of this platform. So we need to bring more public people to this platform, because we are having most of the doctors here, and unfortunately that's not a good sign. So we need minimum 50-50 participation from doctors as well as from the other side also, public people. So then only our promotion of homeopathy will become a great success. And we are lucky to have our president, Dr. Esmail sir is doing wonderful work for promoting homeopathy as well as curing patients at this age of 50th year of celebration, and something extraordinary that that is happening in Kerala. So we are all with you, sir. We want your support and leadership to lead us from the front in the coming years also. Thank you, sir. Thank you very much for inviting me.
I am very much happy about thinking about the LLP. I left the LLP and problem after that Dinesh was come and Shamina was come, Dr. Kapamurti Joseph was come. 3 of enough for me. And Bindu and other Simla and some of doctors also available in the LLP. So anytime I need help, they will give the advice. Then here.
Dr. here. Yes, sir. You can unmute yourself.
Yeah.
You can unmute yourself, sir.
Can you hear me?
Yes, yes.
So I have to convey 2 points, because we are thinking about the end product of the disease actually. So what is the importance of a homeopathy? So to treat the end product, so that is not the way how we have to communicate with the general public. How we have to educate the general public is, if you come across homeopathy, if you start taking homeopathy from the very beginning, from the womb, that is from the pregnancy onwards, so you can close, or you can control, or you can eradicate all the hereditary tendencies like cancer, TB, or diabetes, or any serious illness. So from the uterus itself, you have to start treatment. So even I think Dr. Ken mentioned how we have to treat ladies. So you have to start treatment when you are pregnant. So the ideal time to treat the women is pregnancy, that is Ken's words. So if you start treatment from the uterus itself, you can stop, you can eradicate all the tendencies. Likewise, so suppose if you miss that point, from the very childhood itself, you should start taking homeopathic medicines. You will never get renal disease or tuberculosis or cancer or any serious illness. So that should be the point we have to communicate with the general public. nowadays we are always thinking of the end product. So treating cancer, treating diabetes, treating. So actually they are the end products. These are the diseases which were prompted or created by the modern system or the living habits or by food habits. So whatever may be. So our concept should be, you have to take homeopathic medicine from the very beginning, from the uterus itself or from the childhood itself, so that you will never get such serious illness. So this is the point I have to communicate, and we have to highlight this point to the general public.
Yeah, I was already started this type of treatment since last 35 years.
Yes, sir.
It's a womb pump, the treatment I'm giving. And none of the patients none of the lady having the cesarean, none of the lady having the any complication during the pregnancy and delivery time. Very sure. I'm having the method to give the medicine.
No one is discussing in that way. So from the uterus
I will
itself,
listen. I will give you the clue and the medicine I'm using for this purpose. And the one child having the severe sweating of the head while taking food, while taking water, they were dead, sweating. Even then they are sitting in the AC room, they are sweating. It's a sign of the brain tumor comes in the future. What we are doing, we are giving calcareous hypotension. So the sweating was stopping. Along with the tendency of the tumor also be eradicated. But they know that no, we can't have any proof for it. With bedwetting students, the girls bedwetting, even after 8 years, they definitely will get the womb cancer, uterine cancer. Suppose giving medicine, according to symptomatology, creosote or something, they recovered. That means they recovered from the cancer uterus. Those who main is having this one complaint, we are giving the medicines for them. They will protect the prostate cancer, the future. That type of education we have to give to the students. Then only our our system will come up.
Thank you, Doctor. Thank you, Dr. Sait, sir. So our tomorrow and day after tomorrow, the same session we are continuing. Sait sir will speak about this, the cancer treatment and his clinical experiences. So I would like to call Dr. Abdul Salam from Qatar to vote of thanks and wind up the session today.
Good evening, everyone.
Very good evening, sir. Yes.
All participants and viewers all around the world, especially thanks for our President, Dr. Esmail Sait. Thanks. We can see you tomorrow.
Ciao.
Ciao.
Thank you, Doctor. Thank you, Mr. Abdul Salam. So anyway, we are winding up the session today, and we will continue the session tomorrow and after tomorrow. The Sait sir will speak about the same subject and his clinical experience, and moreover the subject we are expecting more discussions. So you can freely ask more questions to Sait sir for this 50 years experience. So International Forum for Promoting Homeopathy is thanking you once again. Our motto is one world, one health, win with homeopathy. Thank you.